Dr. Kralik is back with us, and we've got a lot to talk about. First of all, people keep saying, how do I know if I have sleep apnea? The big thing is snoring, right?
Oh, the big thing is snoring, Tim. Any type of snoring, especially loud snoring, is an indicator of sleep apnea. There are other indicators too.
And what are those?
If someone's overweight, if they have a diagnosis of obesity, if they have high blood pressure, heart disease, diabetes, all of these indicate that you might have sleep apnea.
Age?
Age is important. The older you get, the more frequently we see sleep apnea. Men have it more than women until women go through menopause, then women catch up with men.
So once somebody suspects that they may have sleep apnea, or they certainly have snoring issues, what's the next step? What do they need to do?
All they need to do is call us, because we can take care of them no matter where they are in Alaska, Tim, because nowadays the preferred method of diagnosis is a simple home sleep test. And this device, Tim, is so small, so easy to use. We send it home with patients, and they use it in the comfort of their own home. No more do they have to go into hospital labs or other laboratories to get diagnosed for this very significant illness.
And we've talked to several of your patients, and they have said that one of their fears was having to go spend the nights in a strange place, all wired up. And they said when they talked to you and realized they didn't have to do that, they were jumping and screaming.
Oh, it's so much easier, Tim, than it was in the old days. This day, over 95% of people we can diagnose with this simple home sleep test.
The most important thing that I would tell anybody who's even thinking about this is it's not hard, it's painless, it's easy. You just come in, they hook you up with a machine, you go home. It's not even a machine, it's a little thing that's less than the size of it's about the size of a garage door opener. You tape that to your chest, you put this cannula in your nose, which you don't even notice, and then you put the pulse oximeter on your finger. Tape them down and go to sleep. You don't really even notice it. You wake up the next day, you bring it back to Melissa, she runs the test. 5 days later, she lets you know what's going on. And then if there is something going on, you come in and they hook you up with the machine, and then they monitor you for a while. It's really simple, and they work really well with me. I don't have a lot of options as far as seeing doctors in the daytime, so they were more than willing to stay here later in the evenings for me to come by, just to drop the machine off, or to see the doctor, or to see Melissa. And she was always ready and available to answer any questions I needed answered.
And Tim, the other thing is, lots of people come to me in my offices throughout the state, but if they can't come to me, the nice thing about this simple device is we can send it to them. We can work with their primary care provider, their doctor, nurse practitioner, physician's assistant, whoever it is. And we can not only diagnose them quickly, we can get them treated quickly, Tim.
So they don't have to come see you?
Not necessarily. I'm more than happy to see the patients, and certainly in patients who live in the big urban centers of Alaska, it's very convenient for them to come. I have offices in Juneau, Anchorage, Wasilla, and we're opening offices in Fairbanks. So it's easy for them. But the people who live in more remote areas, they can contact my office and we can make arrangements. There's also times, Tim, whenever I make trips to smaller towns, Petersburg, Wrangell, Alaska, and places up north.
But the easiest thing for them to do is just to call your office and you'll get them set up.
That's the easiest thing to do, Tim. I have a very good staff, very knowledgeable staff about sleep apnea, and they are on top of it. All of my patients rave about my staff, and not only do they know about the diagnosis of this significant illness called sleep apnea, but we also treat it very quickly.
If you or your sleep partner is snoring like this, it's time to call Dr. John Kralik, Alaska's Sleep Doctor. Sleep testing is easy and can be done in the comfort of your own home. Call Dr. Kralik today. No matter where you are in Alaska, Dr. Kralik fixes snoring. Before Dr. Kralik, after Dr. Kralik.
For me, I think I didn't understand that snoring is a health problem, and I didn't realize its ramifications. I thought it was just a bad habit and annoying to others I might be with, and, you know, occasionally waking me up. And, you know, it's not a very attractive kind of symptom, but I didn't realize how dangerous it could be.
Snoring is a very important factor in sleep apnea. If you or someone you love snores, then they could be at risk for sleep apnea. And the important thing about Tim is that sleep apnea can lead to other significant medical illnesses, including high blood pressure, heart attacks, strokes, diabetes, motor vehicle accidents, and a really big one, death. People actually can die with untreated obstructive sleep apnea, Tim.
Because part of sleep apnea is where you actually stop breathing.
I'm glad you brought that up. Sleep apnea is where you stop breathing. And I have seen people stop breathing 5 times an hour, and I've seen people over 100 times an hour stop breathing. Every time you stop breathing, Tim, every time, then that puts a stress on the heart, the brain, the metabolism of the body, and it can really hurt the patient in the long run.
The most exciting thing is that I had on medication for high blood pressure, and my blood pressure had started to go down. So I have a hope that maybe someday I can not have to take blood pressure medication.
When you are not getting enough oxygen during the night, year after year after year after year, there's going to be, you know, nasty side effects to that. And you know, the immediate difference is that you're going to be feeling better, more energized, and feeling more rested.
This is a significant illness, and we're trying to get the word out so that people can be diagnosed and treated. We were talking about other factors besides snoring, which can indicate that you have sleep apnea. Another common factor is excessive daytime sleepiness or fatigue. You just feel tired all the time. And so many people have this, and they may have sleep apnea. And sleep apnea is important to diagnose because it's easily treated with our modern, what are called positive airway pressure devices.
The results have been great. I'm very happy to have stopped in here because they were very quick, very efficient in letting me know what was going on with after my sleep study. Dr. Krelick's assistant fitted me for a APAP machine, and
That's the new automatic, which is kind of cool, isn't it?
yeah, and it was quite the adjustment, just you know, putting on the headgear and getting used to it. But you do, over a period of time, once you get used to the headgear, you do see the difference between when you would wake up before having the equipment on, where you'd be very groggy and tired, and then after 2 or 3 days of wearing the headgear and using the equipment, that you really feel refreshed.
So you could tell a big difference during the day.
Oh, major difference. Yeah, there's no being tired in the middle of the day, or if you're sitting down doing paperwork or something, or just relax for a minute, you don't really just drift off and fall asleep because you're just so tired because you didn't get enough sleep or proper sleep the night before.
I always counsel my patients when they're first starting on the machine, on the positive airway pressure device, that they might be, in a sense, lucky. There's about a 10 or 20% group of patients who wake up after the first night and they feel great. But 70–80% of the people end up taking a number of days to weeks to start feeling better and better as time goes on. But ultimately we do. The other big thing, Tim, that I want to mention is that the aspect of relationships. So often the spouse has terrible sleep because the patient is not sleeping well. And if we can just fix the snoring, fix the sleep apnea, everybody in that relationship feels better.
You're changing lives, you're changing families, aren't you?
Oh, absolutely. And not only that, we're helping people keep jobs. You know, I have seen people come in here close to tears because they're about to lose their job. And because they're so tired, they don't know what's going on, we make the diagnosis, we treat them, and they're back at full employment. So it's very important. It's a very satisfying aspect of medicine to be able to treat the patient, diagnose the patient easily, and get them back to work, have them improve their relationships, and cut down their risks for other significant medical illnesses.
Okay, let's remind everybody again how easy it is to make that phone call and get started with this process.
Very easy, Tim. All they have to do is call our number, visit our website. We're called AlaskaSleepDoctor.com. Just pick up the phone, go to the website, give us a shout, and we want to take care of you wherever you are in Alaska. And
emphasize that, because you truly can treat anyone no matter where they are in Alaska.
Absolutely. We've treated people from Barrow to Ketchikan and every place in between. So it's easy to do, and it's important to do, Tim. It's easy to get diagnosed, it's easy to get treated, and it's very important for your health, for your relationships, and just for overall feeling better in your life.
And actually, it could save your life.
Absolutely. Absolutely. And I've seen that more than once, that people get on this machine and they are so much more invigorated. And as we talked about earlier, there's always a reluctance to start on this mask at night, but that's not the first step. The first step is get the diagnosis. And then we work with you to help you tolerate the mask, the machine, and we open up that airway, and you're breathing all night long, you're feeling more comfortable, you're feeling more rested, you're waking up more rested, you're awake for the whole next day, and your life is so much better, not to mention your spouse's life, which is oftentimes impacted with this illness too.
Let's remind folks that may be concerned about cost and all of that. You take almost all insurances, don't you?
Oh, absolutely. We work with all insurance companies, and all they have to do is pick up the phone, talk to my staff about it. We will begin the process to get them diagnosed and treated.
So one phone call and they're on their way to a much better life, aren't they?
Absolutely. One phone call and they're on their way to a much better life.